Morning all. Today I'm going to take a class on permanent maxillary second molar by comparing it to that of the permanent maxillary first molar. That is a comparison between the two molars we can see today. So as you know that maxillary second molar has a resemblance to the maxillary first molar. It has a supplement in functions to that of the maxillary first molar. The crown is comparatively slightly shorter to that of the first molar. And the root is almost the same length with less divergence. And the distobuccal cusp is less developed, and the distolingual cusp is comparatively smaller when compared to that of the maxillary first molar. So this is the occlusal aspect of the maxillary first molar that you already know that this is the mesiobuccal cusp, distobuccal cusp, larger mesiolingual cusp, and a smaller distolingual cusp. And we have the fifth cusp of carapace. So we have 5 cusps for the maxillary first molar. While your maxillary second molar has the occlusal anatomy, which has resemblance to both to the maxillary first molar and also to that of the maxillary third molar. So there are mainly 2 types of occlusal anatomy for your maxillary second molar. That is the first one is the 4-cusp type with a rhomboidal occlusal design, which has the similarity to that of your maxillary first molar, having 4 cusps in the occlusal anatomy. But the little difference is that your mesiolingual or the mesiopalatal cusp is much larger when compared to that of the maxillary first molar. Then the second type is a 3-cusp type that is similar to that of a maxillary third molar, while that it has a 3-cusp type. So that is when you see in this occlusal aspect, you can see the 2 buccal cusp and a very larger mesiolingual cusp, while the distolingual cusp is very little or it is absent. So that we have the occlusal anatomy, 2 shapes or 2 resemblance to that of the adjacent 2 molars. Then this is the chronology and measurement. That is, first evidence of calcification is towards 2.5 years, and the enamel completion is approximately 7 to 8 years. Eruption is 12 to 13 years, and the root completion is 14 to 16 years. And this is the measurement table, and this is very important for your carving purpose. So we'll see in detail each aspects by comparing it to the first molar. So as we have already seen that this is the buccal aspect of your maxillary first molar, having the 2 buccal cusp, and you can see the 3 roots here. The 2 buccal cusp, we have the buccal developmental groove between that, which end in a buccal pit. And you can also see the mesiolingual cusp from the buccal side. And some of your distal portions also you can see because you have a slight tilt for your molars. So this is the buccal aspect of your maxillary second molar. The trapezoidal shape is almost same. That is the geometrical shape is trapezoidal for the both. When we see the mesial outline of this tooth, it is almost nearly a straight line and becomes convex at the mesial contact area. While the mesial contact area is mainly in the junction of the occlusal and the middle term. While the distal outline, it is convex comparatively from the cervix to the point where it joins occlusal outline, that is the distal contact area, which is approximately at the middle third of the. And the occlusal outline mainly formed by the cusp tips and their ridges, which is separated by the buccal developmental groove, which is similar to that of your maxillary first molar. The cervical outline is almost nearly straight, which is most common for your posteriors. Buccal surface within the outline, this is your maxillary first molar. You can see the cusp and the developmental groove also. So it is almost similar to that of for your second molar also, except that the crown is comparatively shorter and it is narrow mesiodistal. And your distobuccal cusp is much smaller and shorter than the mesiobuccal cusp. So that a part of your distolingual cusp and the distal marginal ridges can also be seen from the buccal aspect. The same for your maxillary first molar. Your maxillary second molar also have a buccal developmental groove which separates your two buccal cusp, similar to that of your maxillary first molar. So we have discussed the buccal aspect. Then we will go in detail about your lingual aspects. So when you see from here, I think you can remember your maxillary first molar also. That is for your maxillary first molar also, we can see the palatal cusp that is seen in the next slide. This is the maxillary first molar. So this is your palatal root, and this is your mesiobuccal and your distobuccal root. And this is your mesiolingual cusp, which is the larger mesiolingual cusp, and this is the smaller distolingual cusp. And you can see the cusp of Carabelli, which is seen lingual to your mesiolingual cusp. And you can also see your lingual developmental group. So next is the distal aspect, lingual aspect. We'll discuss about the lingual aspect of your maxillary second molar. So the trapezoidal shape, that is similar to that of the buccal aspect, and also for your maxillary first molar. Then your crown outlines, your mesial, your distal, and your cervical outline are almost similar to that of your buccal aspect. So this is your occlusal outline, which is formed by your cusp tips and your cusp ridges. So you can see a more sharper mesiolingual cusp, while a rounded distolingual cusp can be seen. Again, here also your occlusal outline is interrupted by the lingual developmental group. So within the outline, you can see the distolingual cusp is much smaller and shorter than your mesiolingual cusp. Lingual cusp is smoothly convex except for your lingual developmental groove, which separates your two lingual cusp. Then in your first molar, you have seen the fifth cusp. That is your cusp of Carabelli, which is seen lingual to your mesiolingual cusp, which is absent in your maxillary second molar. So the main differences of your maxillary second molar from the first molar from the lingual aspect are your distolingual cusp it's much smaller in your maxillary second molar. This is the distolingual cusp of the second molar, and this is the distolingual cusp of your maxillary first molar. So when you see itself, your distolingual cusp is much smaller, and the distobuccal cusp can be seen through the sulcus between the mesiolingual and the distolingual cusp. So here you can see the fifth cusp while it is absent in your maxillary second molar. The apex of the lingual root is in line with the distolingual cusp instead of the lingual groove, which is seen on the first molar. That is lingual groove. It is lined with the apex of the lingual root. It is in line with the lingual developmental groove, while here the apex is in line with the distolingual cusp for your maxillary second molar. So next is the mesial aspect. So this is the mesial aspect of your maxillary first molar. So you can see the buccal outline, you can see the lingual outline, and you can see the mesiobuccal root, and this is the palatal. So here, this is your mesiobuccal cusp, this is your mesiolingual cusp, this is the fifth cusp or the cusp of Carabelli, and this is a mesial marginal ridge. Then we can see the maxillary second molar trapezoidal shape. Geometrical shape is again trapezoidal. Shorter side is towards the occlusal portion, as we have already discussed in the maxillary. Then the buccal outline. So this is the buccal outline. It is more convex in its cervical third, and it's less convex from here up to the mesiobuccal cusp. So the buccal contour, it is in the cervical third of the crown. So the buccal contour of all the molars exhibit a maximum convexity towards the cervical third because of the presence of your cervical ridge. Next is the lingual outline. It is convex from the cervix to the mesiolingual cusp tip. The height of lingual contour is approximately at the middle third. The next is the occlusal outline. Occlusal outline, you can see the mesial marginal ridge, which is comparatively smooth concave, merging with your mesiocuspal ridges of the mesiobuccal cusp and the mesiolingual cusp. Cervical line is almost a straight line. Then within the outline, it is comparatively convex, and the crown has a tapering, appears shorter than the maxillary first molar. The mesiobuccal and the mesiolingual cusp are almost of the same length, although your mesiolingual cusp is comparatively larger. Then we'll move on to the distal aspect of the maxillary second molar. So this is the distal aspect of your maxillary first molar. So this is the distobuccal root, and you can see from here on the distal aspect itself, you can see a part of the mesiobuccal root, and you can see the palatal root. So this is the distal aspect. From the distal aspect itself, some portion of your buccal surfaces can be seen. Why? Because the crown has a distal taper. So that some of the occlusal surfaces can also be seen for your maxillary first molar. So this is the distal aspect of your maxillary second molar, trapezoidal shape, similar to that of your basal aspect. Then crown lines, the outlines, that is the buccal, lingual, and the cervical outlines are all similar to that of your basal aspect. So we'll see the occlusal outline. So occlusal outline, your distal marginal ridge is at a lower level when compared to the basal marginal ridge. And also it is comparatively irregular, and it has a sloping towards the cervical due to the smaller distobuccal cusp. And within the outline, it is narrower and shorter than the mesial surface. So as your distal marginal ridge has a lower level, some portion of your occlusal surface can also be seen, and also some of your buccal surfaces can also be seen from the distal aspect. Next, we'll move on to the occlusal aspect of your maxillary second molar. So as we have already discussed, it has a 4-cusp type and a 3-cusp type. 4-cusp type, it has a similar to that of your maxillary first molar. 3-cusp type, it has a similar to that of your maxillary third molar. So the relative dimensions, your buccolingual dimension is more when compared to your mesiodistal dimension. And your distobuccal cusp is very small and it is less well developed. And the rhomboidal form, which has a similarity to that of your maxillary first molar, your mesiolingual cusp is the largest, followed by the mesiobuccal cusp. Distobuccal cusp is less well developed, and the distolingual cusp is also smaller and seems to be separated from the rest of the occlusal portion. That's you know about the primary cusp triangle. We have already discussed about this. The oblique ridge is comparatively less prominent, and you have a tapering towards the distal surface. Multiple supplemental grooves can also be seen from the occlusal aspect. The similarity to that of your maxillary third molar, that is the heart-shaped form. Here, your mesiolingual cusp is well developed, as seen in the maxillary first molar, while the distolingual cusp is very much smaller or even absent, so that the crown has appearing a heart shape. Then root, 3 roots are present, same as that of your maxillary first molar, while your buccal roots are comparatively more inclined than that of your maxillary first molars, and it is close approximation with each other. Lingual root does not have any divergence, much that. And the apexes are comparatively sharper than the maxillary first molar, and the 3 roots have a inclination towards distally. So variations, fused root, long or short roots, supernumerary roots, crowns with accentuated rhomboidal outline can also be seen with multiple small tubercles. And the development anomalies, dilacerations and concrescence. Dilacerations means that is a sharp bend of the root can be seen. And the concrescence means the fusion of the cementum or the via root can also be seen. So this is your post-class evaluation. You have to write the similarities and the differences between your maxillary first and the second molar. And thank you.